Now we're joined via Skype by health activist Dr. Kgosi Letlape to look into the latest developments on the coronavirus and where at stage it might be advisable to maybe go back to national lockdown, hard lockdown. Dr. Letlape, thank you so very much for joining us on SABC News.
Thank you for inviting me, Snow, and good afternoon to the viewers.
Now, just as a start, we're hearing word of possibly moving to hard lockdown again. I'd like to find out from you, what is your view on the matter? It does seem as though there are people perhaps not taking lockdown very seriously and all these measures that have been put in place, and we're really seeing those numbers climbing quite at a staggering number as I've read out those numbers this afternoon. What is your view on the issue of perhaps going back to, a harder lockdown?
My view is that we are not united as a nation, and we have not taken advantage of the actions of government in terms of early action and an early lockdown. So we have not really maximized on the opportunity of slowing down the infection. We're getting towards our peak, and the numbers are not as good as they could have been prior to getting to that peak. And I think we should take collective responsibility as South Africans for not having heeded the call quite well. And we should now all regroup to understand that COVID will be stopped in the communities, not in the hospitals. And it's our collective responsibility and our putting others first that will make us overcome this pandemic.
I mean, Doctor, I'm sure you're looking at these numbers with great concern. Do you believe that enough was done to prevent the numbers, and I'm talking on the side of officials of our government, to prevent those numbers to reach those levels that we saw in, some European countries and China, in America? Or is it inevitable? Are we really ourselves going to a point where we are going to see those numbers that initially a couple of months ago were really scaring us?
The numbers are really depend on the public's behavior, because it's public health measures that will keep the numbers down. The lockdown has not been removed. We're just at a different level. Now, the principles of leave your home when it's necessary still applies. Just go and do necessary work. Avoid partying. Avoid sitting with families. Avoid crowds. Do things that are only necessary. But when you venture out, do everything you can to protect others in terms of protective equipment, that being a cloth mask, or the appropriate behaviors in terms of physical distancing. And the numbers we see is society not maximizing on what we've been informed to do. Where we may also take collective responsibility is this has not been our mantra. This has not been strong in our messaging. As typical South Africans, we've been looking for faults in the system. We'll be looking for negativity instead of making sure that we spread the message and we keep repeating the issues of hygiene, the issues of hand washing. It's fairly simple.
Yeah. Doctor, we've heard all the precautions.
Hand wash, physical distance.
Yeah, we've heard all the precautions, and you've raised them again. We've heard them all: washing of our hands, using sanitizer, social distancing, wearing of masks. Is there anything more, Doctor, that we could be looking at? I know that there's been a lot of talk, and I'm looking at social media quite often, and there's some talk of certain herbs and umhlonyane perhaps being used. Are those things? Should we really look at everything possible, in our own spaces, in our own homes, that could possibly assist us?
We should look at everything, but we should remember that a virus doesn't have a ticket, it doesn't pay taxi fare, it's got no way of being transported. The only way it is transported is from one human to another. So, notwithstanding the other measures of improving your immunity, it just increases your resistance to being infected. But if we keep spreading it to each other, if we keep close physical contact, if we don't ensure that what we've had gets implemented, no matter how much you boost your immunity, we're going to have numbers that are crazy. So people have to understand, And this is my appeal. Let us not pack what is freely available and is of great effect in terms of keeping the virus to look at things like those things are important in terms of immune boosting. But you've seen people with good immune systems get infected with the virus.
Yeah. Would you support the call then by Gauteng Premier David Makhura saying that they will be asking the National Command Council to reinstate some of those harder restrictions that we had? I mean, especially as we hear that Gauteng's numbers will increase quite significantly and might in fact reach the levels that we have seen in the Western Cape and the Eastern Cape, and that slowly but surely we will get there.
Yes, but remember, it's not about what the Premier said. It's about what community does, and the virus sets the pace. As the leading expert in the US, Dr. Tony Fauci said, it's the virus that's going to determine what you do in society. And it's how we kept the spread of the virus that is the key determination of that. The officials will just be looking. People should not forget that we went into lockdown with very small numbers. And the authorities have been quite lenient with numbers rising and the relaxations occurring. And people should remember this. We forget what we were saying, that let's stay out of the hospital. There's only one way you protect the hospital. It's by doing your part in treating yourself as being COVID positive and just upholding your part of the bargain, that you will not be the one that spreads the virus anyone in the public or in your family, and take all the precautions as we have been told in terms of what to do. It is inevitable that if the numbers keep rising, if we close down with small numbers, it would defy logic to understand why, as the numbers become uncontrollable and our health systems become overwhelmed, why we would do further relaxations or not go back to raising the ante in terms of the lockdown.
All right, Dr. Letlape, it's always a pleasure having you on SABC News. We do appreciate your input as always. Thank you very much.
Thank you very much, and thank you for the opportunity. And please keep those masks on, physical distance, hand wash, go out only when necessary. If you have symptoms, if you're sick, seek medical assistance. But we should also understand that if you have a mild illness, you are not a patient for the hospital. And I think what we should be concentrating upon is ensuring how do we support people to isolate at home? How do we ensure that they know what to do if they have a family member that is COVID positive but does not require hospitalization? Those are the key issues in terms of keeping the spread. Let's talk about public health messaging. Let's talk about isolation and quarantining, and what support do we give to each other in the community, in our own home.
All right, I'm sure and I'm hoping that South Africans will heed your call and the advice that you've given to us. Thank you again, Dr. Letlape, health activist, Dr. Kgosi Letlape, of course, who's also a GP, a physician as well. Thank you for your time.